Violence Against Nurses in the Workplace by Marcy Powell. Workplace violence in the healthcare industry can be physically and psychologically damaging, especially to nurses. Nurses strive to provide safety and care for patients. However, when violence is involved, this can cause a difficult choice between patient needs and their own personal safety. There are various forms of workplace violence, such as direct, physical, or verbal assault. According to the American Nurses Association, 1 out of every 4 nurses have been exposed to some degree of workplace violence. In addition, a recent study found 67.8% of nurses reported some sort of physical and verbal violence between February 2020 and June 2020. The nursing profession is considered to have the highest rate of violence, which occur mostly in specialties such as emergency, geriatric, and psychiatric settings. A majority of workplace violence-related incidences reported by nurses were predominantly against females, with verbal abuse being the most prominent type of aggression. The growing issue of workplace violence in the healthcare industry has a major impact on nurses and the nursing profession as a whole. It results in the disruption in the therapeutic setting and a complete disruption in providing care to the patient, which in turn may be the reason why so many nurses are leaving the profession. Inadequate staffing in the industry is a result of nursing shortage, which is cause for concern because many nurses are feeling stretched thin. This results in nurses having more patients to attend to and less time to spend with each patient. So patient care is often diminished. Further, there can be a negative impact on nurses' mental health, as unhealthy work environments have been linked to poor mental health, specifically with psychotropic medication use, anxiety, burnout, and insomnia. Violence against nurses in the workplace does not only affect nursing and healthcare staff, but also trickles down to the quality of patient care. As I mentioned previously, if nurses are leaving the bedside due to unsafe working environments as a result of violence, there is a compromise in patient care and safety. Inadequate staffing causes nurses to have higher patient ratios, hence less time to spend with each patient. Therefore, the health of the patient can suffer. This can also lead to massive patient frustration and dissatisfaction with the nurse and healthcare setting in general. This may cause patients to wait longer, which can cause them to become uncomfortable or be in unsafe situations. When workplace violence occurs, nurses become the victims. Therefore, they have a responsibility to advocate for themselves and the nursing profession as a whole. Nurses need to be responsible for being more vocal with workplace violence and report any violent act immediately in order to help prevent future incidences from occurring. It is imperative that all nurses be familiar with prevention programs and policies, attend safety and training programs, and alert supervisors of any type of violence through standardized procedures as soon as possible. Organizations and governing agencies such as Occupational Safety and Health Administration and the Joint Commission are involved in promoting safety and universal protocols to prevent workplace violence against nurses. The Occupational Safety and Health Act of 1970 states that employees are responsible for providing safe and healthy workplaces, setting and enforcing standards, and providing education, training, and assistance. OSHA gives guidelines on how to prevent workplace violence, including management and worker commitment, worksite analysis, hazard prevention, and safety and health training. The Joint Commission recently revised workplace violence prevention standards in January 2022. The revised standards have enhanced awareness practices, prevention, and management of violence in hospitals that are accredited by the Joint Commission. Spreading awareness is essential, which is why the Commission has been proactive in issuing newsletters, blogs, presentations, and podcasts focusing on concerning and preventative topics on the workplace violence. Violence in the workplace should never be condoned nor taken lightly. However, something positive can be taken from a negative situation. Having more awareness educates nurses on the warning signs of potential violence, what specialties are prone to being violent, and understanding the personal safety is essential in the healthcare industry. This can also allow nurses to become empowered about completing incident reports and making management aware of harmful situations. Another positive are prevention plans that are being implemented to help stop violence in the workplace altogether. The Silence No More Foundation is proactive in reaching out to state representatives to pursue more effective laws in protecting healthcare workers. One such bill includes the Workplace Violence Prevention for Healthcare and Social Services Workers Act of 2021, which was recently reintroduced to the U.S. House of Representatives. The bill would require healthcare organizations to put violence prevention plans, procedures, and identifiable risks into practice immediately. One major disadvantage is how costly workplace violence is to the organization and the healthcare industry. According to OSHA, one hospital system had 30 nurses who required medical treatment due to workplace violence related injuries, which cost about $95,000 total. Injuries and stress that come along with workplace violence can also cause nurses to leave the profession for good. If this occurs, it is estimated that replacing a nurse can range from $27,000 to $103,000, which includes recruitment, hiring, orientation, and training. Other disadvantages the healthcare organization can endure include caregiver fatigue and stress from injury or violence, which can be correlated to medication errors and patient infections. Further, there is also a possibility of nurses underreporting workplace violence, as the Joint Commission notes that only about 20% of workplace violence in the industry are reported. The American Nurses Association has a code of ethics for nurses with interpretive statements, which states that nurses are to create an ethical environment, which includes treating all those in the healthcare setting with dignity, kindness, and respect. The ANA is very adamant in expressing the nurses will not tolerate any violence from any source, including patients, families, or fellow colleagues. The Code of Ethics has specific provisions that discuss obligations the nurse should act upon if need be. Provision 5 is of specific importance as it states that the nurse owes the same duties to self as to others, including the promotion of health and safety, preserving character and integrity, maintaining competence, and continued personal and professional growth. This can be considered quite difficult and an ethical dilemma for some nurses because of the ethical duty nurses have to provide care for others. It is apparent that there is an overwhelming amount of violence that the nurses are exposed to on a daily basis within the healthcare industry. Protecting both the patients and self are extremely important. However, there needs to be an understanding of why the patient is acting in a violent manner. Is it due to disabilities, psychological factors, substance abuse, or overall dissatisfaction with the healthcare system? No matter what the root of the issue is, there should be accountability for the act of violence. Therefore, incident reports always need to be reported and evaluated so situations can be prevented in the future and nurses can become more knowledgeable regarding violent situations. Nurses should feel safe in the workplace and provide care without the fear of injury or psychological distress correlated to workplace violence. Thank you.